Ataro Stephen Ayella, yes, again. And many of you remember him in his powerful presentation he had earlier this year. And so I know we are all in for another insightful session with him. Dr. Ayella is going to introduce himself, but the little that we know about him is that he's a primary care physician, sports and exercise medicine. And we know he's a member of the Canadian Academy of Sports and Exercise Medicine. He's also the chairperson, U.M.A Sports and Wellness Subcommittee. And you very much know that he's the team doctor and fitness trainer, the She Cranes National Netball team. And I am your moderator, Dr. Danny. I'm actually Dr. Dmongs Daniel, but many of you know me as Danny. So without further ado, allow me to invite Dr. Taro to take us through the basics of physical exercise and why it matters for our wellness. Dr. Taro, you have the floor. Thank you.
Thank you. Because of night and probably bandwidth, I may not show the video, but as you can see, my photo there can clearly show my appearance. For those who have not met me, I want to salute you all, especially my senior colleagues and all the colleagues. Medicine is a hierarchical profession, and it's important to recognize seniority. I had earlier on recognized Dr. Sebuku, whom I met far back in 2007 in Fort Portal. It's been a while. Yeah, so colleagues, I want to appreciate Uganda Medical Association leadership, especially the president and the NEC, as well as the welfare committee, under which the Sports and Wellness Subcommittee sits. I have been privileged to serve for the last 4 years in this position. I would like to hand over to my vice chair and also support them on the backyard as part of leadership transition. I will share this presentation with some sciences as well as sports aspect, but also at the end, if you're interested in developing career in sports and exercise medicine, we can talk about that. So for those who believe in God, Philippians 4:13 says, I can do all things through Christ who gives me strength. The reason I bring this is because I do a lot of things and people ask me, how do you get the energy? Where do you get the time from? So I hope to inspire you to multitask as well. Now, physical exercises are important for our lives. These are just my photographs when I am doing different exercises. The two in yellow is 2015, so it's a while ago when I was still more youthful. But the one with the black minute jersey is just recent when I was doing my workout. Remember from the last presentation, we talked about the 8 dimensions of wellness. And in this, just a recap, we have spiritual, emotional, physical, social, intellectual, environmental, financial, and occupational dimensions. So in order for you to be well, you need to balance all these. Whenever we talk about wellness, most people run to body mass index. And I mentioned it last time that it's one of the indices or indicators used to assess well-being, but it's not practically possible for everyone to have the normal BMI range, partly because of geographical variance in terms of stature, physique, biomechanics of the body. But the important thing to note is that even if your BMI is not normal, as said, your other parameters can be normal. I'm going to show you along the way. Now, you remember the limits, the weight, and then the body mass index in kilograms per meter squared. Also, as a recap from last week, we talked about 4 pillars or components of wellness. One is adequate nutrition, which means you balance all the essential nutrients required, carbohydrates, proteins, fats, vitamins, micronutrients, all that. And then the second one is to have adequate rest, which includes sleep at least 7 to 8 hours a day. And then you have music, relaxation, resting, off the phone, taking holiday, travel, doing physical exercises, which is what we're going to look at today. And then the fourth one was you need to do routine medical check. And in case you're found to have pre-existing conditions or medical complications, then you need to take adequate medication. So I want to pause here and ask you, how many of you have done a check this year? You can type in the chat, or if you've never done, check your renal function, liver function, cardiac function, prostatic specific antigen, especially for us above 40, thyroid hormone, reproductive hormones, and so on. It's important. And you sit in hospitals which can do these things free of charge. So you really don't need to shy away. Now, part of my work in government, I monitor services. When I go to hospitals, I go and do this test just to see how the lab is functioning, but also to do a wellness check. Please note, you don't need to go to a bariatric surgeon to cut the tummy, to do liposuction. You can actually do healthy lifestyle and maintain your weight within the normal range. All right? And those who know Wayne Rooney, Mark Viduka, Yakuba Yegbeni, these are guys who were playing soccer when they're almost 100 kilograms. But they are so fit and fast and really, really agile. So there's no problem. The only issue is they have big weight. Now, doctors, there is an analogy we are to worry about. I've put them in red because it's a red flag. For you who is listening to me, we spend long hours studying. So it includes doctors, nurses, midwives, health workers, pastors. We spend long hours studying. We spend long hours standing, working, sleepless nights, and necessarily we've made ourselves busy. Doctors have many dependents, so there's a lot of social pressure. If a doctor is getting married, a man, they will inflate the bride price so highly. If sisters have been married, the one who is a doctor when she's being married, they even can triple the bride price. And yet, you're the same normal person like your sister who has done social sciences. Doctors suffer silently. We don't speak. There's the concept of be a man. And then we tend to die young, suddenly, unplanned. Most people are not on insurance, and yet you are working on a very risky situation. 3 weeks ago, almost 4, I did a surgery in Bududa General Hospital. Imagine a 32-year-old gravida 3, para 2, 2 previous cesarean section scars, comes in labor at 42 weeks and 5 days, and she had labored home for 10 hours. She had never attended antenatal care, no scan done. She was carrying twins. Now, I was called to theater when she was already on table because I needed to assess their set, know how they ran. So to perform, I worked with the doctor there, only to remove the first baby. This is Moana. The next one is who? What is the Bamasaba name? Wamono. I imagine twins discovered on table. None of the people, including the midwife who admitted, wrote on her notes that there are 2 fetal hearts, this. So in case something happened, that would be such a serious problem, and you find they are not insured. Now, societal pressure I already mentioned. Many doctors don't care for themselves in the disguise of not having time, ever busy, not eating, not resting, not taking a holiday. I want to ask you, how many of you have taken time and gone for holidays? How many of you have crossed the border? How many of you have flown a plane? These things are for you. Why not? You live once, you're going to reach a point when you have no energy, you can't move, and you'll say, I wish I had done that. All right? So it's important. Now, we have list of presidents who died in office, okay, and heads of state. John Pombe Magufuli, Tanzania, Pierre Nkurunziza, Meles Zenawi for Ethiopia, Levi Mwanawasa, Zambia, John Atta Mills of Ghana, Umar Yar'Adua, Nigeria, then Amadou Gon for Cote d'Ivoire, Didier Guillaume, Monaco. Look at them. They all died in 50s and early 60s. This is very low. Most people live even 80, 90, and their conditions, heart attack, sudden cardiac arrest, infection, stroke, illness, heart and kidney failure, heart attack. These same things can happen to doctors, right? So these are presidents. How about Ugandan physicians who died young? Dr. Lukuya died at a young age of 43. I'm now 49. Dr. Yasin died in 2020. Dr. John Akule, he died of Ebola. I was there in Bundibiju that time. Dr. Samuel Mutoro, my OB, and was opposite my room at university. Actually, a week before his death, I spoke to him from Liberia. I was working there. We know Dr. Spire Sentongo. Then we know Dr. Mohammed Ali, the Tanzanian who died recently, and many others. But the point is, these ones have died young, leaving families and all this. Now, much as some of them are related to things beyond, like maybe accident, but still there is a way you can plan your life and avoid some of those issues. Then Christian leaders also, for those who are believers in God, look at pastors, age 30, you're dying, age 42. Prophet TB Joshua, well-renowned. I'm told he predicted even his death, he knew, and really finished the sermon. Then he left to rest, feeling unwell, and finally was gone. So all these people could have actually lived longer if they took care of themselves. Of course, I know while faith, they say, no, everything is predestined by God, but it's important. We are scientists, and we know scientific evidence are important. Now, this is my core area. Biomechanics is the science which deals with how the body is structured and performs its functions. Kinesiology is basically about movement, right? So I've gone deep in studying kinesiology, how the science of human body, objects. This is like applied physics of the human body. So the musculoskeletal system, or the locomotor, is designed to function, to execute functions and movement through the joints, articular surfaces, muscle fats, and all, and they work in a coordinated manner. So this topic of sports biomechanics I was teaching it in Chambogo University and Gulu, but government universities recently, so I'm not teaching anymore, but I used to teach that topic, and I love it very much. Now, being stationary or not moving the body parts is a very big risk for many diseases and body malfunctions. Wasting contractures. Now imagine a surgeon who stands in theater for very long and this surgeon doesn't exercise. The body can become stiff. You can get postural hypertension. You can get immobility and even dyskinesia. I'm using medical terms since we all understand this. Consider a car which is parked for long without moving. It will rust, systems will reduce in efficiency, the tires deflate, and so the body is the same. You begin getting swelling of feet, stiffness of muscles, joints, loss of physical strength, fatigue. Geriatrics is another topic. I can talk about aging and physical exercise some other day. But when you look at the old people, their bodies wrinkle and they become shorter because of the changes in the curvature, and then the muscles, the quadratus lumborum, which is inside, begin losing bulk, and then it shortens, and then you get that curvatures, and most older people are shorter than actually they were. Then you need to perform basic movement. Moderator, please check whoever's thing is on, and then you can mute them. Yeah, you need to function in such a way that you're able to move the body, exercise it, and gain fitness. So what is it that we call physical exercise or fitness? First of all, fitness is, we do activities, exercises to achieve a level of fitness based on certain parameters. Now, exercise is any bodily activity that enhances or maintains physical fitness and overall health and wellness. So some people walk, some people dance, some people skip, some people jump, some people dig, some people carry manual work. All those are physical exercises. So don't be teased by people who do aerobics in the gym, people who run marathons. No, you can actually walk around your compound 50 times and you've done the daily. Joyce Meyer one time preaching said, I've walked around this table hundreds of times. When you put a pedometer tracker, you find that she has covered almost 2-3 kilometers. Many individuals do outdoor exercise where they can congregate in groups, socialize, and improve well-being, as well as mental health. In the other presentation, I showed our classmates when we met for our 20th anniversary out of medical school. and we are doing beach exercises, running, jogging together. Now, how much you exercise, the type of exercise you do, where to do it, when to do it, with whom to do it, are all at your discretion. So this is the epidemiological approach now. Epidemiology looks at event, time, place, person, all right? And where, maybe. So during our secondary school days, we would have a function or social, and then one guy would draw a cartoon and says, each man to his own dancing style, but the same music for us all. So you can choose the exercise to do. You can dance Kadodi, you can do the Chiganda dance, you can do La Kubu Kubu for Acholi, you can do break dance like Michael Jackson, but all of it is at your own discretion as long as it moves the body and gives you some level of fitness. Now, why do we do exercises? What are the indications to promote or to aid growth and improve strength? Among us here, there are people, probably medical students or those below 25. We know growth stops at 25, but some people even still continues, 18 to 25. So you can actually still grow, whether horizontally or vertically. Prevents aging. So when you exercise, the effects of aging will be reduced. I'm going to show you somewhere when I show you my biochemical profile. Then therapy or treatment. So post-surgery physiotherapy to ease contracture, stiffness, we do that. To develop muscle bulk, function, strength, agility, to improve cardiovascular functions or reduce risk of diseases. Even to improve respiratory function. Like during COVID, I was training people on breathing exercises to help improve the lung functions. Because most people who got COVID, they had reduced lung function, some lung collapse. So we do breath holding and training to improve that. Then occupational requirements for endurance. For example, military parade, police, those exercises help you to achieve that. Exercise can help is if you're doing protest and advocacy, like walk to work. You need to be fit, otherwise you'll collapse. We know an archbishop who collapsed after, although there are different theories, but he walked the way of the cross and afterwards he rested and that was it. Then corporate or team building, like if you're doing cancer walk, rallying, commemoration of events. Exercises help to improve athletic skills, endurance, performance, acclimatization, speed, agility, strength. You see? Now me, because I'm used to contact sports, whenever someone is playing, I want them to be very strong. What in our netball term, we hashtag it as Muzanyika Ganda, you know? You want to tackle people and give them no space, but of course within the confines of the rule so that you're not penalized. Exercise can also help with weight loss, weight gain, or maintenance. I do prescription of exercises and other activities for those who want to maintain their weight, those who want to lose, or those who want to gain. Also to improve the health and general well-being, especially sound mind, simply for enjoyment, relaxation, competitive events, muscle bulk show, fitness, entertainments, gymnastics, dance, for leisure, killing boredom, and forgetting unpleasant memories. Whenever we meet, we throw games, balls, doing this like little children in high school, in primary. Now, when you look at this photo, I'm running wellness program with different hospitals. So Gulu Regional Hospital, we have a program with them. You can see from the picture, some of the people are way over 100 kilograms, but they are trying. We do at their pace, all right? So there we are stretching, then we are doing some trotting, use of resistance band on the left. Now, weightlifting is very tricky, especially for the older people. Bones are getting osteoporotic and density is reducing. You can easily fracture. So the options is to use resistance band, that photo on the left-hand corner. Then doing stretches, sitting down and all that. This one is Moroto Regional Hospital, our senior consultant obstetrician. You're not in, but this is your team as you can see them. Moroto really surprised me. I went to do a session in June, and by 6 a.m. there were 45 people, as you can see this number, gathered. And this is such a high level of institutional embrace of wellness. wherever you're working, you can actually start. It's not as hectic or difficult as it is. Now, if you have questions, you can put them in the chat, or you can note, moderator will take them. Physical exercises can be classified into different types, mainly three. There is alternative classification as well: aerobic, anaerobic, and flexibility. Now, from biology, we learned that aerobic respiration, that means you use oxygen. Anaerobic, no oxygen. But in sports and exercise science, anaerobic doesn't completely occur in the absence of oxygen, but with little oxygen. You see that? That's the difference. So aerobic involves large muscle group use, causes the body to use more oxygen than it would while resting. And the goal is to increase cardiovascular enhancement or endurance. Examples can be running, cycling, doing treadmill, brisk walking, skipping ropes, rowing, literally contacts or high intensity interval trainings. And then anaerobic, on the other hand, which includes strength and condition, firm resistance, it's more of static. It helps to improve the muscle mass, improve coordination, bone density, but they are more of static than dynamic exercises. So pull-up, push-ups, lunges, squat, bench press, and even weight training. Those ones help you to increase the short-term muscle strength. But for endurance and performance in sport, aerobic is the one that we use. Then there's a flexibility exercise. These are exercises to improve the flexibility, stretching, range of motion. And it can also improve agility. It can come with their three muscular actions. There's what we call concentric action, which are actions that are aimed at shortening the muscle length. Then isometric contraction, that means it maintains the length. And then there's eccentric action, which means it increases the length. So it's important that if you exercise for 20 to 40 minutes, some group book says 30 to 45 minutes, 3 to 4 times a week, it's optimal to kick away the cardiovascular diseases or to reduce them in case they come. So we have alternative classification, which is static or dynamic. The reason we bring this, there are these Paralympics who cannot run, jog, and do all this, but they still do exercise. So dynamic exercises are steady state running, produces lowering of diastolic blood pressure during exercises due to the improved blood flow. But static, it tend to increase systolic significantly. However, later on, someone is typing something, Deo Gracious, please don't move the cursor. So static only exercise certain parts of the body, not the entire body. Now, the type of exercise prescribed should be guided by the need for exercise, your physical state based on your health assessment, and also the therapeutic indications. For example, if you're doing exercise to ease contractures or to relieve pain or to improve mobility and gain power, then they are prescribed accordingly. That's why you need a physical therapist or an exercise instructor. I caution people, these gym instructors who don't know anatomy, who have not dissected cadaver, be very careful with them because they've caused more injuries to the body than what they've done. How about exercise and food intake? There is an article which was written, I wrote it, I think during COVID time. They said, do not hit the bar after drinking. There's a relationship between exercise and alcohol intake, then exercise and diet. Then I wrote about bathroom accidents. Then I did breathing exercises for COVID. Then 2-meter distance, not adequate to protect people in motion because the COVID virus is dense. So when you sneeze, it can fly. I also wrote about the spleen shin syndrome and then the athlete's knee, among others. So a number of studies have investigated exercise and food. But in human studies, there's been inconsistent results. And we noticed that there are several independent variables if you're to look at exercising and food. So you wouldn't take food as just one single thing. There are other things. Some people have very high metabolic rate. So even if they eat now, within a short while they are hungry. So that would not actually affect them gaining this, especially those with thyrotoxicosis. The physicians here can explain this better, endocrinologists. So when you're considering exercise, put all these factors together, and maybe you run a logistic regression model, and then you can drop them one by one. But it's generally advised to regulate food eaten during exercises to avoid complications. So you eat lightly. For our athletes, especially those doing boxing, a 0.5 kilogram change in weight can make you be upgraded to the next category. So we try to encourage them to eat very little, especially pre-competition. There are alternatives. The use of granola bars, crunches, which you eat. It doesn't fill the stomach, but gives you the same amount of calorie that you need. Now, look at the food here. When I was in Juba, I had 2 events. So on the left-hand picture is food which I ate in my house. I just boil beans with Irish, then I take milk, then there's fruit salads. On the right hand, we went for a workshop, and that's the kind of food. Fast food, lots of oil, processed. And now, whereas the right-hand side looks posh or couth for this current generation, it is extremely dangerous. Cafe Javas, KFC, all those fast food, extremely dangerous, ladies and gentlemen. I mean, I tell people, you don't have to prove a point to anyone. You've eaten enough meat, regulate it, especially meat which has stayed for long in the fridge and what, uric acid, all those complications. Now, what are the implications of not exercising? I'll look at effects of physical exercises in the body later. Then questions will come at the end. A lack of physical exercise or activity will cause disease burdens and risk. Generally, there's increase in type 2 diabetes up to 7% compared to if you don't exercise. I mean, if you exercise versus you don't exercise. So this statistics is looking at self. If you're one person, if you exercised, you would be 7% at a lower risk of getting type 2 diabetes. Even breast cancer, especially through lymphatic function system. And we know that breast cancer even can affect men. Colon cancer due to malabsorption, constipation, consequences of heavy weight, obesity, and related morbidity, joints get fibrotic, and all that. So overall, physical inactivity contributes to 9% of premature mortality worldwide. How about swimming as an exercise? Some of you say, I don't know how to swim. Swimming is actually, we call it hydrotherapy. Just going and dipping yourself in water, even if you don't know how to juggle it, it's very healthy for the body. It cools you, relieves muscle soreness, it suits the body. So please just go to the swimming pool, measure the height which cannot sink you, dip yourself in even if you don't know how to swim. It's good. Swimming keeps the heart rate up, but takes some of the stress away. It builds endurance and muscle fitness because you exercise the whole body. It tones the muscle and builds strength. Ladies, when you've given birth, swimming can help you tone the tummies. Healthy heart, lungs, and so on. It's safe for pregnant women as well. It cools the body. You could use a jacuzzi at home. And then you can do hydrotherapy. Now there's this sizzling of water. I use it for the legs for physios. Maybe one day, U.M.A, we should organize a boot camp where we do the practical thing, not just the theory here. And then I expose you to all the things, manipulations we do in sports and exercise medicine. It's really relaxing. Last year, we did a medical camp at Kampala Baptist Church. One doctor came and said, you guys, whatever you're doing, I want you to do on me. So massaging, using massage gun, relieving stiffness of the trapezius and what. It was nice, and he kind of felt sleepy, you know. There's also aromatherapy, the beauty parlor. Many people go for it. But I want to caution you. Please recall the anatomy. When you look at the anterior compartment of the thigh, the flexor compartment of the hips. So we have L2, L3, L4 nerve roots, supplying rectus femoris, the vastus on the medial, and all that. And then around the groin area, we have the genital branch of there's the genitofemoral nerve. So we have the genital branch, which is L1. Now, when you do a light touch on the thigh, especially the inner, instead of massaging, you end up stimulating the release. And so you can actually do genital secretions. You turn on somebody. So be careful. This is what people do in beauty parlors. They don't understand. So for the thigh, you need deep tissue massage. That's when you can stimulate L2, L3, L4. Otherwise, the moment you touch L1, you're causing problems. Aromatherapy, the good thing is it can relax spasms, improve sleep, pain, control heat. It burns the fat, but there's a lot of risk associated, especially injuries and death in the sauna, steam bath, all those. So you need to be a little careful with that. Acupuncture is also one approach used. Vascular compression stocking is another thing, tingling and all those. Chinese do a lot of them. Now, you may not need to do exercise as a competitive athlete, but you can play a number of games. You can walk, you can jog, you do brisk walking, you can run around, you can play soccer, just this Shauriako football where, like in St. Joseph's, Umbachi, we used to play soccer. You would be like 100 people in the pitch. You get the ball, you kick in any side, you give to anybody, you dodge, and play. Some of us playmaker, you get the ball, you dodge, and then you kick out to make people run after it. Just for fun. Boxing, you can do shadow boxing. Nabanja does boxing. I came from Glasgow. I arrived today. And last week, when I was in Glasgow, I met a boxer from Solomon's Island. So he came to the room where I was and he was doing weight checking. So I began talking to him and giving him tips. The man is like, oh man, I wish you could coach me. I told him, well, I started boxing in 1992. Featherweight, I was boxed out. I never returned until Dr. Onen, the neurosurgeon, took me back in 1997. And we used to train in Lugogo and Zambia, sharing all like that. So I was giving him tips based on the biomechanics. If you're tall, someone is this, do this. If he's taller than you, guard like this, give an uppercut. The man was so impressed, So you can actually learn skill. Badminton, I still play up to now, even in the compound here. Soccer, athletics. But some games have failed, like volleyball, I've really failed. Even basketball, I'm not in there. Frisbee, I played from Liberia. So there are different events. Now, there is a doctor who is from Teso. I need to remember the name. Maybe Dr. Lubega can remind me. U.M.A had a sports gala with the Uganda Society of Architects on 9th of September 2023. The man had never ever heard the word archery, but he went and he shot it and he won a gold medal. Imagine just trying something first day because he used to hunt in the village with arrows and what. So you can actually start up some games. Golf, most people who play golf, they start in old age. Now, impacts of physical exercises on the systems. I think we are midway into the talk, maybe about 15 more minutes, then we go to questions. A vigorous workout affects hormones, neurotransmitters, and autonomic nervous system. So recall the nerve supply to the genitals. We have the pudendal nerve, cavernous, and genitofemoral I mentioned. Now, exercise also raises and sustains levels of enzymes in women and even men. That increases genital blood flow and arousal. That's why before you engage in that precious event, you need a preliminary stimulation. Recall the sexual response cycle. We have the arousal, we have the excitement, we have the climax, and then the resolution phase. All right? So if you do 20 minutes of exercise, running around, jogging and what, it will boost your sexual arousal by 169%. That's why we see animals, they run around, goat, following each other. All those is to stimulate the hormone. Testosterone is a vigorous hormone. Once you exercise and do aggressive work, it shoots up. But it later goes down. And then it rises up when you've rested, especially for a minimum of 4 hours. So exercise reduces stress hormones, but it promotes the release of endorphins, which promotes mental alertness and a good feeling. And endorphins are released a lot in sex, especially when you reach your climax. Also, sex can be taken as a physical exercise. It burns calories more in men than women. So there's a scientific evidence that exercise can improve sexual function. And those who have a dysfunction, especially due to weak pelvic floor muscles, the obstetricians here can tell us, exercise can help strengthen it and improve the grip and function. All right? It also improves the stamina and strengthening. So Kegels exercise is recommended, especially after birth. Maybe you've got tears and maybe the muscles have not returned or contracted well. Then the full planks, squats, lunges, it helps to improve abdominal strength. And then also pelvic lift, twisting and frog stretch, duck walk and all that. The Moroto team, remember, I showed them how duck walk is done. Cardiovascular system, this is needless to know. Exercise improves cardiovascular performance. It lowers cholesterol in blood. It also helps with reducing incidence of coronary artery disease. And then at the end, it reduces generally incidence of heart attack, stroke, and so on. However, in case you have aneurysms, you need to be careful, because as you exercise, the pressure in the vessels increases and it can rupture. So overall, exercise lowers blood pressure and maintains blood flow and limit clots. Some people talk, I didn't put about alcohol and exercise, but medically, the only alcohol recommended is red wine, which helps to dissolve the cardiolipins, keep the blood more fluidy, and also it reduces incidence of clots. So whether alcoholic or not, I take Pure Heaven non-alcoholic red wine, and it helps improve digestion, reduces bloating, and really keeps the heart healthy. Somebody asked me on doctor's chat, where's the peer-reviewed thing? Well, the food you eat in your village, I don't think even there's peer review in it, yet you know it works. So exercises in the musculoskeletal system helps to reduce stiffness, keeps the connective tissue fibers of the ligaments and tendons flexible, improves the range of motion. And then it improves mobility. It also gives you strength. It builds you up, and weight gain. It also helps with toning the muscles, burning fats, and maintaining shape and figure. How about mental health and psychosocial status? It's clearly known that exercise helps to improve mental alertness, well-being, improves the mood due to the release of endorphins, the feeling good hormones, and then it boosts memory and mental alertness and better work concentration and removing disruption. Nervous system, it produces healthy gene expression, cognitive functions, and then it can also help to increase neuron growth and really reduces the. I also mentioned that exercise helps to improve the work of breathing. It improves the lung functions, and especially for those who live in polluted environment, you need really adequate function. The forced expiratory volume can sometimes be very low, and in case you have allergy, asthmatic conditions, you have a reduced lung function. So exercise helps you in addition to improving this, but it also reduces the incidence of respiratory tract infection. Immune system, needless to say, exercise helps to boost immunity. If you've seen soldiers, they train bare-chested, I should have put my photo for training here when I did in 1998, introduction to the camp. I was real fit, and really doing strenuous activity helped to boost your immune system. Digestive system, we know exercise promotes the growth of bacteria, which promotes produces the fatty acid and butyrate. Now that can help to repair the gut lining, reduce inflammation, and also can help with the insulin resistance, which if not addressed can actually lead to diabetes or worsen it. Digestion also helps. In case food is well digested due to exercise absorption, you don't get bloating, you don't get constipation, you don't get all those bowel diseases. Now, appetite will increase for some people, for others it may not, depending on how used you are. Myself, I'm at a level where exercise doesn't change much really how much I eat because of the strength and conditioning I do. We have a test of fitness criteria, and I want you to remember this. When you're walking uphill, walking upstairs, doing a short distance run, carrying a heavy load, doing physical activity, treadmill test, stretches, bending, push-ups, how long can you go on? This is endurance. Do you get panting, rapid breathing, or mouth breathing?
Dr. Tala, we seem to have lost you. Dr. Talo, we can no longer hear you. We do not know where the problem could have arisen from.
Maybe his network problem is lost. So I believe we can hang around for a while.
I see is off, and at the same time, it's full to capacity now. Him getting back again is an issue. Let's see how we can maneuver. Even our moderator himself is locked out, so that's how I'm trying to come in. But let's see how we can go.
Hello. Sorry, something happened and I dropped off. But let me continue from where I was. I hope you can hear me.
Yes, we can hear you now, Dr. Taro.
Yes, sorry, something happened and the meeting limit was exceeded, was reached. So are we seeing this slide?
Yes, doctor.
Yes. So now, when you look at this, I do monitor body mass index. I monitor different parameters. So these are the same thing, but let's go on first one. So when I started in June, I weighed 74.6 kilograms. All my parameters were normal. Body fats, fat-free body, visceral, except subcutaneous, which was slightly low. Normal is about 17. Now, later on, after exercising, doing workout about a month later, and it gave me a metabolic age of 48, but my age is 49. Now, about 4 weeks later, I lost 3.65 kilograms. And I was weighing 72.25. Everything remained within the normal range. And my metabolic age came to 46, meaning 3 years younger. But now, I went to the UK, though I did a lot of walking, but maybe I ate too much, I don't know. I've gained weight, I'm in 74.9. The BMI is still normal, body fats, but the subcutaneous fat went up, and my metabolic age also went back to 48. So I use this for tracking performance. And when I assess you at the beginning, then I send you to exercise. Now, these are biochemical pictures that we need to monitor wellness. So somebody might be 100 kilos, the BMI will show high weight, maybe this, but the rest is okay. Those are cellular level activities, okay? So this is, now what is important? Consistency. So these are measurements taken 2 months apart. If you're not consistent, I had done well, I dropped, then again I gain. But of course, within a week, I can get back to the previous status. Now, that aside, the subcutaneous fat is just a little thing. When you gain weight, adipose tissue. So I ate maybe a lot of chocolate, yogurt, and so on from there. That's why this slightly increased. But again, the percentage is not much. Now, when you are exercising, please be mindful of injuries. You see the athlete there is injured. I think that's a player of Bayern Munich. And they got a knee, ACL tear. And then myself on the left, I was operated in Nairobi 2018. I had chondromalacia, cartilage was worn out, and it had caused me pain. You need to take caution when you're exercising, especially if you have pre-existing medical conditions, metabolic diseases, cardiovascular, and all that, chronic ill health due to immune suppression, TB, and cancers, chronic medications, cancer chemotherapy, history of those, trauma fractures, because recurrence is common. And then when you have arthritis or rheumatism, especially in the cold, then the other aspect is ergonomics. When you're not using adequate smooth surfaces, the attire you're wearing, and the type of exercise for the intention. Also, when you have chronic respiratory diseases, if you're geriatric, old age, those with prosthesis and metal implants, if you have chronic body pain, immobility, and contractures, and non-acclimatized travelers, as well as disabilities not well monitored, and then weather conditions, maybe dusty, very tricky environments. Here, I was sweating, doing aerobics, and so on. Now, this sweat can actually cause you problems. You can lose electrolytes, you can become dehydrated, you can get hypoglycemia, but you have to be careful. So the gym, I caution you guys, the gym instructors just keep doing, go on, without knowing, without assessing. Women generally have more flexible joints than men because of the progesterone hormone. But those that are overweight tend to have calcification at the joints. So maybe you have bursitis of the knee and even the joints. So when you tell this person to move, it will be really difficult. So you need to first assess. So stationary bikes, you can use them, but if it stops suddenly, that's a problem. Saddle bikes are better. Treadmill, you need to be careful with knee ligament tear. Weightlifting, you can get a surgical PID, prolapse intervertebral disc. So you use alternatives, resistance band, which can allow you pull exactly your weight. You can do squats, pull-up, push-ups. Basically, avoid weights. I don't carry weight in the gym, but I use resistance band. You can do tummy stretching, dumbbells, use of trampoline. That's okay. There are common tissues and cellular injuries that occur. Causes when you do multiple exercises in simultaneous command, like you're doing flexion, rotation, multiple body parts in one. Please, you've got to be careful. And then weightlifting, which is not proportionate, wrong type of exercise for the particular indication. Someone has the microphone on, please, can you mute? And then not eating after heavy exercise, you can faint, or overeating even when the abdomen is distended. Drinking alcohol before, during, or immediately after. Moderator, please, can you mute someone who is on? Check. Daniel, please check and do the needful. Weather factors, temperatures being adverse, and then not wearing the right type of shoes or attires. There's also an article I wrote about choosing the right shoe for particular exercise and sports. And then exercising when you have mask on, perfusion of air. It's good to filter, but it can be tricky. And then exercising on unlevel surfaces. Then sudden collapse. We've seen football players fall in. Vivian McFall, a Cameroonian player, collapsed in 2003 in the Confederation Cup and died. Others have got heart attack and so on. So hypoglycemia is common, especially following drunkenness. In 2002, we were for university games in Dar es Salaam. One player from Kenya played rugby. He had a collision and died, but he had drunk himself silly the whole night. You know, dehydration, especially hyperosmolar or hypertonic. Then there's concussion. Daniel, can you please check whose microphone is on and maybe you talk to him? Mention the name. Might not be aware.
Yes, Chimba, kindly.
Chimba. Yes. Then concussion, following a fall, hitting the head on ground or collision. There's syncope. Dr. Chimba, please, can you mute? Then coronary artery disease. Admin, please remove him if you can, because now he's not following. Remove him.
We don't have the host, Dr. Ayella.
Dr. Chimba, please, can you mute? He might have put the phone and is not even following. Then there's carbon monoxide poisoning. This is common in saunas. Please watch out. You go to sauna, the room is closed, you inhale fumes, you get carbon monoxide poisoning. Lactic acidosis can come in, stroke, embolism, ruptured aneurysm, heat stroke, heat exhaustion. Then you can get frostbite when you're in extreme coldness. And then you can read about bathroom accidents. I authored an article about it one time in the media. Now, sports can be very interesting and a leisure moment and luxurious. On the left-hand corner top, this is when Uganda made a maiden reappearance at the Netball World Cup in Sydney. We finished number 8. In the middle, this is a team of Uganda Christian Medical Fellowship who were in India at the World Congress. My daughter by then was 5 years old. She was reading scriptures as we were starting to sing. Then the photo with the red t-shirt on the upper corner was just this recent trip on the 15th of July when I was traveling to UK. A patient was sick in the plane and they called for a doctor's help and I was helping. You can see I was taking blood pressure. This guy actually got a renal colic and he was in so much pain, but thank God to sports, we managed pains at advanced level. So I attended to him. This is the 3rd time when I treated patients in the plane. There's a time I did also coming from Canada in 2014, July 2024, and Ethiopian published it on all their routes. Below, this was Netball World Cup 2019 in Liverpool on the right-hand corner. Then in the middle, with the yellow t-shirt, I was for interview in SBC Radio, Swahili channel, about the sports in the Netball World Cup 2015 in Australia. And then down on the left hand is Glasgow, Scotland. We were there for Celtic Cup and we had an unbeaten run. We beat every team that competed. So it's a nice moment. You become a celebrity and you have fun. People come for autographs. So sports is good actually.
Are going to press.
Then here, I don't know how many people you can recognize in this picture. Those who follow me on social status, WhatsApp, you can remember. On the top left-hand corner, I am here with Paul Lowry, a 57-year golfer from Scotland. He's a millionaire. The guy, he came to speak for us last week in the Sports Medicine and Sports Surgery Conference in Glasgow at the Royal College of Surgeons and Physicians. So I took a photo with him. In the middle is a well-renowned professor of sports medicine based in Australia, Professor Kate Webster. She has authored widely in sports and exercise medicine. On the right-hand corner, this was 2019 when I went for induction in the US, New England Complex System Institute. They accepted me as a co-faculty, which is at the level of assistant professor of complex systems. So I do visiting, I teach in the United States. But with COVID, we changed the mode of engagement more to online. So the man on the right is the president of New England Complex Systems Institute. And then the guy on the left, the taller one, is the president of Massachusetts Institute of Technology, the leading business university in the US. I'm with them, you can see. Then down, I'm with Ethan Walker, who is a sportsman in Scotland, a footballer. He traveled on a scholarship to the US and was knocked down by a speeding car in New York. He got such a terrible accident. He was treated in ICU, but he recovered and did a cycling of 1,200 kilometers from Glasgow to Munich in Germany. There's a movie about him. And then on the left bottom is the former captain of the netball club for Scotland. She's called Claire Maxwell. We met with her several times in the World Cup. So these are people who are millionaires and you have time with them, you know, because of sports, and you become a celeb. I'm almost coming to the end. I talked about leisure and adventures in sports. In 2015, at the grand opening of the Netball World Cup in Sydney, I got the opportunity to entertain delegates. I played keyboard, music, and did a performance at the grand opening. Now, this is really sheer luck for a village boy of P.O. Box Agago to go to Australia where they don't know your father and mother, and then they allow you to entertain delegates at the grand opening of the Netball World Cup. It was such a deal for me. 26th of August, 13th of August, 2000 and what? And 15. Then in 2018 in March, I spent 5 consecutive nights in 5 different countries, in different continents, after a sports event. This photo here, I took it in Doha when we had arrived from the US. I was in Bridgetown, Barbados, the next day in Miami, US, Thursday over the ocean in the air. Friday, we arrived in Doha, we slept. I flew to Entebbe, reached there, removed the uniform, put on layers, went to Nairobi. Saturday 17th, I slept in Nairobi. Sunday, I traveled back to Somalia. I've been to 46 countries in the world. I've boarded very many airline companies, I think 78. And then I've landed in 108 different airports in the world. Of course, like Nairobi over 100 times, Dar es Salaam almost the same, Juba almost the same. But the question is, what is it that you're doing with yourself? You have a role to play. Some of you are doctors, you can come in the sports team. Some of you are businessmen, you can sponsor. Others, you can come as a spectator or supporter. Concluding remarks. 1, exercise requires discipline, commitment, diligence, and company. 2, you need finances. Nobody should lie for you unless you're going to play Shaoriyaku soccer, which if you get injured, still you need treatment. You can do formal or an informal exercise. You can set your own gym. I normally guide people to set up exercise spaces at home. Public gymnasium needs to be handled with care. Medical screening and assessment is needed to be done prior to the exercise. And the need for fitness and exercise at institutional level. Gulu Regional Referral Hospital is working well with me. Moroto Regional Referral Hospital is working well with me. And you can set up private physiotherapy services in your different hospitals. So if there are questions, remarks, clarifications, we can now go to it. Thank you very much. Over to you, moderator.
All right. Thank you so much, Dr. Ataro Stephen Ayella, for the wonderful and very, very insightful presentation. I must say that your presentation has attracted quite a number, and I was one of the victims of the numbers. When somebody called me, my network went off a bit, and I couldn't rejoin because the meeting was full. In that state of panic, we had to create like a new Zoom link, but it did not pick up the way we expected, so I had to join in back. Thank you so much. Let us take in questions from the listeners. And,
so maybe let me go through the chat first and answer those ones while we prepare. Yeah.
Okay.
Okay, someone is calling, what's the name of this monitoring platform? So this is an app on the phone, but it comes linked with a weighing scale, which is digital. So I use this weighing scale for monitoring. Once you link the phone, you download Aero scale, but there are different weighing scales. So you download in your phone and device, then you enter your parameters. And then once you stand on it, it computes it automatically. Maybe one day, if we have a physical session, I can show you. And then send Google form for CPD, that's yours. Then which other ones? Okay, the Zoom link. What if one is introverted and doesn't like the limelight of celebrity? There are options for smaller group where ergonomics may be addressed, say among surgeons in training. Yes. So what happens, I mentioned at the end that I help individual to customize. Like me, I do my exercise program at home. Myself with the children, we play indoor. I need only 2 meters by 2 meters to make me do all the exercises I need. So you don't need to worry about going to the gym and so on. You can actually set your exercise at home, but you know it needs company. If you're 2 people, you can encourage each other. If you're just one, it might be difficult. You see that? Then yoga, you can do them. But again, dancing according to your cultural music. In Moroto, we are doing Kadodi dance, we are doing La Kubu Kubu, we are doing all these different things. So it doesn't have to be in a gym, maybe on in a town with a dreadlock or what. And again, you do it at your own pace. So professionals have, you've mentioned surgeons in training. Yes, this is important because different occupational requirements give us different exposure. Surgeons stand long, physicians sit longer, except maybe when doing a ward round. So at the end, you have to balance and make sure it's adequate. Orthopedic surgeon, there's a lot of manipulation, lifting. Sometimes your joints are paining, but these days there are automations now. For us in sport, there's a lot of manipulations. You sweat. When I'm doing physio and so on, you see really how much you're manipulating the joint. You also sweat yourself. All right? Thank you. Florence talked about favor. Yeah, from Pure Box, Agago Village, going to Australia and doing that. That's fine. Then, which other question? I think those talk about lack of exercise, obesity, and sudden infants. Okay, so we've seen high school obesity children who are obese, and it becomes part of the norm, and parents get stigma about it. They don't want, but something can be done. Although before you do this, you need to assess the biochemical profile, liver function, kidney, cholesterol, triglycerides, and all that. Otherwise, if you just put someone in exercise, you may find that there's atherosclerosis and arteriosclerosis, meaning oxygen delivery to the tissues are not adequate, and this person can collapse and die. So for me, when someone says, I want to gain weight or lose weight, I first assess you and study your feeding profile and all that, body biomechanics, and then give you adequate. Now, I maintain my weight strictly on diet and exercise. I don't take any supplements to do that. Which exercises are for weight gain? Drake, what happens? You have to do high intensity interval training, which will allow you to increase appetite, and then you can gain weight. However, take note of the genetic variants. Some people are naturally thin, skinny. You can add this with the food, eating high calories, nuts, taking millet porridge with the peanut chipoli OOD, you put them in. Those ones can actually help you gain some weight. Yogurt, if you take those ones. For those who drink alcohol, the malted brews like Guinness, Tusker Lager, those are the biggest culprit of making you gain weight. So you need to avoid them if you want to reduce weight. And then what else? I think another common, thanks so much for the good presentation. We'd like to know if there's any direct relationship between genetics and weight gain, because most people who are overweight gain into this. So basically for everything, there's environment and genetic. But most of the people, you look through your classmates, like I have my students, and in medical school, they were 50 kilos, 60. But after now, they are 90 kilos. So you cannot say it's genetic. They've just gained weight, eaten so much. And for those ones, it's even easier to reduce. Genetic are people who join year one university, they're 80 kilograms, maybe, and then they've grown all along, they've been big. But you can still do exercise and be fit with that weight. So can you share a program for district officials to start their exercise workplaces? There was a directive from Ministry of Public Service. So Kimpton, this directive from the ministry came, but it's not been followed up with the operationalization. And we had held discussions with the ministry to have a national wellness committee, which initially they proposed Dr. Sekimpi, myself, Professor Catherine Abo, and Dr. Dr. Christine Ondoa, but this has not taken off. So what we are doing is we are trying to work at institutional level. So you, for Agago district, you can arrange and then we come and customize for you. The science, we have it, but the operationalization depends on your resources and the context on ground. I discussed this partly with your newly elected chief, LC5. So we can pick it up from there. But you have to budget for it. Moroto is doing very well. They've made a budget and they are moving it to another level. Okay, Kalunji, Gonzaga, they are exercise for weight gain. Yes, weightlifting can help you, but you add with the diet as well. You eat and so on. So, like, I cannot give a one size fit all. I have to assess your profile, your eating habit, your metabolic rate, your hormonal profiles, and so on. Right? Now, dietary management, Moses Wambazu is asking, what particular exercise for those on dietary management of type 2 diabetes to increase sensitivity of the insulin receptors? Okay, the endocrinologists have a bigger role here, but what we normally do with the diabetes, we are cautious about exercise because we are more worried if you overdo and you get hypoglycemia, it's a more dangerous thing than the hyperglycemia. But we can join hands with the diabetologists and then work on this well. And please take note, for you to achieve optimal exercise impact in this, it's not a one-off. A lot of things have to come in and then on and off. So we monitor the profile over some time. There are some limitations to exercise, those with history of major surgeries. Yes, I mentioned that. You do more of dynamic exercise, static than dynamic, but also you gain slowly. So for example, if you've done cesarean section, there's a worry that abdomen may be weak. But you see, if you do limb stretches and so on, that helps. And then the static exercise help you to achieve the cardio physical function, burn the fat in the overall, and at the end, you are better off. We can customize this. The good thing is, as doctors, we have a duty of care to colleagues. So you're really free to consult. There's no problem with that. Are there relationship between physical exercise and infertility, especially female infertility? Now, those who are very unfit, they tend to have hormonal imbalances, but exercise helps to stimulate the hormone level. So, for example, it is again a question of endocrinologists, gynecologists, nutritionists, and sports exercise scientists coming together, look at you case by case, and sometimes even psychiatrists. By then, most people forget infertility has a lot to do with mental ill health. You find that there's anxiety disorder, there's some stressor which suppresses the hormone release, and at the end, it does not, especially erectile dysfunctions in men. So why do some people lose weight everywhere else but struggle to lose abdominal fat? Okay, abdominal fat belly is actually, it builds up very easily, especially those who take malted brews, those who are inactive. So it needs a high intensity cardiophysical. There are also sweat belts that we can prescribe, you wear it. It helps to tone down, but there's also thermogenic belt, which helps to burn the fats by creating a high thermal gradient. They're available here, you can use it. And then later on, once you've done, you are able to do a high vigorous physical activity, the fats will begin toning. Then there are abdominal exercises or push-ups, which you can do to trim that. But most people don't endure that, so that's the challenge. Okay, grade 2 fatty liver is my condition. I'm overweight. Any advice what to feed on and that? I'm on alcohol. I'm an occasional alcohol drinker. Been taking soda so much. How can I lose weight? I think this might need a biochemical profile assessment, and then you do a one-to-one profile. However, alcohol, like I said, leads to increased weight and fatty liver. So if you reduce alcohol and you embark on only red wine, it will actually dissolve and reduce that. Malted brews cause a lot of weight gain. And of course, weight gain, fatty deposit in the tissues. And if you take dry gin, whiskeys, and those really spirits, they also cause aortic liver cirrhosis. So you've got to be a little careful about that. Okay, I was diagnosed with pulmonary embolism, treated 2 weeks ago. I felt dizzy, and up to now, can exercise be of help? Yes, but you do incremental, steady exercise after doing a proper lung function assessment, the work of breathing and all that. Otherwise, we might end up sending you into cardiorespiratory failure. Gym versus outdoor exercise for those who are on exercise therapy. I prefer natural exercises, walking, brisk walking, jogging, high intensity, because gym has a lot of injuries, although it can achieve quick result, right? Does replacing sweet bananas for lunch cut weight? So the way the body is, if you eat breakfast in a higher quantity, you reduce lunch and reduce very much on dinner. Most people cut lunch, yet they are busy working, and then they eat a lot of dinner. Dinner, it will all be absorbed because you're not active. So you instead, you'll eat lunch better, but cut dinner if you want to reduce weight. Fat belly, I haven't picked much on the supplements part of it, but okay, supplements can be used alongside, but please take note that these supplements are metabolized as drug in the body. So it's better you go natural with exercise and manage the diet. Thank you for the wonderful presentation. Okay, I think I've read those ones. If there are any questions, you can raise the hand now. Moderator, I think we have 15 minutes to go. Yes, Danny?
Yes, thank you so much. I have seen a couple of questions that have been asked, and we have been able to respond to almost all of them. Then there is this concern here that do you have a YouTube channel for these exercises?
Okay,
For
good
fitness at
question.
home.
Yeah, it's still a work in progress. Previously, I had recorded some video sessions and so on. But again, it's not a one size fit all. What I'm now trying to do, work out with Moroto Hospital, regional referral, is that we will do sets of exercises and then record those videos and share the links to help. But again, our biomechanical profiles are different. So we need to probably get assessed first, know the normal, and then embark on that. Now, look at a person who is a heavy drinker. I take him in vigorous exercise, he will collapse and die. So I have to go slowly with him while reducing alcohol, improving water hydration, and so on. Some people asked me in the past, I get body pain so much, what do I do? Maybe another day when we have time, we can organize session on common sports injuries and managing it. But we have electrolytes that we use, rehydration therapy, so electrolytes which you take as tablet. Then we have those ones which you dissolve in water, they are effervescents. Then we have the energy drinks which are sports approved, and then there are creams and gels we use and so on. So it's really not a one size fit. Okay, exercise for osteoarthritis. Osteoarthritis, you need to be very careful because the joints get stiff. You have bones rubbing bones, sometimes cartilage is worn out. We do assessment, do MRI scan, and look at the profile, and then you start supportive and you begin releasing the joint slowly. Surgery is being discouraged, especially in low resource setting, because it doesn't change much. The best thing is preventive. In Canada, I attended basic team physician course and the conference symposium in April, and we had one session on comprehensive management of osteoarthritis. So there are braces that we use to support, freezes and gels, which helps you to reduce pain and ease mobility. That's the mainstay treatment. And of course, reducing weight, because if the weight is much, then it will create a lot of pressure on the knees and on the ankle. Okay. Is there any other question I missed? Okay. Wait a minute. Do you support exercise for necrotic joint which are stiff? Yeah, so here what we do, We first release the stiffness and the contractures through manipulative reductions and use of infrared therapy and braces. I have all these things actually I use for practice. So I practice sports and exercise medicine 40% and public health 60%. That's where I draw my salary from. So I do domiciliary and institution based and so on. So I do assessment, and there are all these devices which we can use to assess. You see? Then wait, I'm trying to read the messages, but okay. Sylvia, thank you very much. Where can I do the biomedical profile, Alison? So one is you can do your hormonal blood profile picture, liver function, kidney function, prostatic specific if a man, hormone profile for women, and all that. You do all that in the lab. Then for the parameters, you see the fats and so on. We have the scale which we use, which is automated and linked to the app, right? So that can be done. I think those are the questions. If there's any other which I've not asked, you can raise the hand. We have the surgeons here, orthopedics. You can also supplement because, you know, sports, it rides a lot on other disciplines. Most of our sports surgeons are actually orthopedic surgeons. So you can share a comment or based on this. But like for the backache, most people, the chronic backaches is mainly really due to muscular spasms of the latissimus dorsi and then the serratus anterior, as well as the quadratus lumborum, which is on the inside, and rectus spinae. So, you know, at the iliac crest, on the outer lip, the gluteus maximus originate. And then on the inner lip, quadratus lumborum, and then latissimus dorsi. So latissimus goes the whole length up to the shoulders and inserts in the medial groove of the bicipital groove of the humerus. So anything that irritates it along will cause that back pain, and it takes very long and causes also a lot of referred pain. So it's important that you work on it in context, you know. And then once that is there, you ease even the spasms on the neck, the trapezius, the deltoid. And then on the anterior compartment of the thigh, the flexors of the hip, you work on that as well as the extensors of the leg. So there's a lot of anatomy in which you really have to apply. Okay, any other concern? Josephine is saying consider organizing more of this session to unpack comprehensive presentations handling this. Yeah, that can be organized. Once they do the CMEs, yeah, we can always talk. Remember, I've not handled sports injuries. I've not done physiology of exercise for the aging. I've not done maybe exercise for the chronic cases, those who are chronically debilitated, and so on. And then even the details of other things like bathroom accident, then assisted devices in exercising, like use of bracing, taping, and all that. And for those of you who have interest in sports and exercise medicine, you can side chat, we talk. There are opportunities, except that scholarships may be difficult, but I mean, you can dive deep. If you're a surgeon, you do 10 laparostomies, that's enough to pay for a course in sports medicine. And that's just 1 week work. Your physician consultation 100,000 in a specialized clinic. You can add on, do sports cardiology, and so on. It's good to change because it really helps. Not only sports, there are several other courses you can do. Okay, moderator, if there are no questions, over to you. Check the hands.
All right. Thank you so much, Dr. Taro, once more. I'm checking onto the list of our participants, but I can tell that members exhaustively released their minds in the chats, and they have really been ably answered. So for the meantime, as we plan to close, I would welcome some
There's
remarks
a hand
from
Abubekar. There's a hand from Abubekar.
Okay.
But
Yes,
maybe
that is
before you mention Danny, if you can link
yes.
up with the U.M.A CPD, we probably need a bigger Zoom link because this one of 100 people kept dropping on and off. At least if they can make bigger ones, then it can help maybe 300 people. That's one. Or you can repeat the sessions for those who did not attend, because 100 users limited the people.
All right, thank you. Let us hear from Dr. Kange Abubakari. Yes, Dr. Kange's hand was up. I suppose it was an error, but I now see Dr.
Moses Wambas
Moses.
is also there.
I see Moses
so
Wambas.
Yes.
Rebecca's question is answered already about the Zoom link. So Moses.
Okay.
Yeah, thank you so much, Dr. Ataro, for this presentation and especially demonstrating these practical aspects of it. I think I really advocate for this, and I believe it's the right time because, like, our Ugandan demography or epidemiology is changing. We see a lot of non-communicable diseases on the rise. We see a lot of transition in the eating or dietary methods. We are now feeding on a lot of processed food. So burning the energy, burning the fat is like the way to go. I do believe it's in order if we collaborate through the U.M.A. Maybe like in every month, we have like one session of aerobics. It can be like online like now. So like you would be there in your room, you are demonstrating, and we're like also in our room watching and doing them, and then we're able to share experience. I believe that could be one of the ways to practically transition this into real life experiences for us. Thank you.
That is well noted. I will also follow up on the operationalization of the National Wellness Committee. Dr. Jim has said you can provide a Zoom link of 300. Thanks, that's good. Because you see, U.M.A, we have over 8,000 members. And if we've reached only 100 or 200, but inconsistently, we probably need more. Yeah, because this is part of day-to-day things that help us. I'm not undermining any theme, but compare with research on a rare disease which you'll never see in your lifestyle. Yet this is something that you live with daily. Yeah, thank you. Danny?
All right, thank you so much. I do see no more hands. I want to also confess that I'm one of the victims of the limitation of the Zoom link. As soon as I got off due to some network disturbance, I couldn't rejoin. It was really sad. So I think we are heading towards closure. We're going to have we didn't have an opening prayer. We shall have a closing prayer by Dr. Mugenyi Deborah. I don't know if she's still around. I think she has logged out. We can have a closing prayer by Dr.
Johnny, Dr. Jim has put an email there that you write requesting for Zoom link if you're going to organize for bigger talks. And remember, I've only handled physical exercise today. Wellness is a continuum. The psychiatrists have to talk about mental well-being. We have to talk about sleep. We have to talk